In this video, you will learn about the nursing responsibilities of a nurse during intubation. On that note, let's get started. Do not forget to inform the consultant doctor about the intubation as soon as possible or beforehand if possible, even if it is an emergency intubation or elective intubation. Make sure you arrange all the needed equipment for the intubation. Inquire about the equipment needed and followed in the current hospital you are working in. It would be better if you maintain a pocketbook with all the details about the equipment and the procedure they follow during intubation in the hospital you are working right now. A checklist like this will help you not miss anything. It will be handy in case of emergencies which arise out of the blue and when your brain stops working out of shock. Take consent for intubation from the patient's nearest kin. If it is an elective intubation procedure, take consent from the patient himself. Make sure to check the working condition of each equipment needed during intubation yourself or with the help of a biomedical engineer. Be sure to remember all the checklists that you followed before procedure and all the events that happened during intubation with time, so that you can document all of it in the nurse's notes. A well-written nursing notes will save you when something goes wrong. Load all the emergency drugs and paralyzing agents as needed and as advised by the doctor who is about to intubate the patient. If it is a elective intubation, that is, if it is a planned intubation, get the facial hair shaved if the patient is male, so that it doesn't trouble you while using dynaplaster and ET tie during the procedure. Even if it is an emergency intubation, you can shave the facial hair after intubating the patient so that you can use dynaplaster and ET tie without any problem. Make sure that you and all the staff involved in the intubation procedure wear all the personal protective equipment to avoid any body fluid exposure. Maintain aseptic technique throughout the procedure. By opening only a small portion of the wrapper of the ET tube, check if there is any leak of ET tube cuff. Check if the hosepipe tip of the ventilator for oxygen and air pressure fits properly in the ports available for them. Make sure that they are snugly fit and there is no oxygen or air leak. See to it that the suction jar is fitted properly to avoid any loss of suction pressure. Get the mechanical ventilator calibrated with the help of a biomedical engineer to avoid any breakdown during the procedure. Check the working condition of the light source of the laryngoscope. Pass the doctor the equipment needed according to the sequence of steps followed in the process of intubation. Push the medications, that is sedatives and paralyzing agents, in the sequence as advised by the doctor who is intubating. Keep an eye on the monitor to notice any abnormalities of respiratory rate, heart rate, ECG rhythm before, during and after intubation. Check bilateral air entry immediately after intubation. After confirming the correct position of the ET tube, secure the position of the ET tube with a ET tie. Get a chest X-ray done after finishing the procedure of intubation to confirm the correct position of the ET tube. So these are the nursing responsibilities that I wanted to share with you all. If there are any other nursing responsibilities that you think are important for the nurses to follow during the intubation process, please comment below.